our training, we will be discussing working with lesbian, gay, bisexual, and transgender older adults. According to the Administration for Community Living, 1.575 to 4 million older adults that's 60 and older identify as LGBT. The 2021 American Community Survey estimated 1.2 million same sex couple households in the United States, and of that, 59% were married couples. When working with this population, there are many factors that we should take into consideration. And one of those things we will discuss is the economic status of LGBT people. They are more likely to experience food and economic insecurity, have lower incomes, unemployment, and disparities in their wealth and financial security. The LGBT population, in comparison to other populations, are, as I said, more likely to have these disparities and these deficiencies when it comes to food and health. And of that, Blacks, Hispanic, and females are also at a higher percentage in comparison to working with the LGBT community. When working with the LGBT population and we're talking about health, some of the things that we need to understand is that they are more susceptible to psychosocial stressors that affect their cardiovascular health. And of those things, we need to be very mindful of how we navigate the healthcare system when working with the LGBTQ. Because of a lot of discrimination, not understanding the terms that the LGBT community use, some of them are gender non-conforming, and how that affects the way that healthcare providers look at their health. And so one of the things that we can do as social workers is helping the practitioners understand that we should listen and follow their lead. And as I stated, they have difficulty in openly discussing sexual health related issues, higher rates of anxiety, depression, stress, mental health. Assumptions are always made based on the appearance of the LGBT population. And we are not as good as screening for violence and other factors that may contribute to them being not only physically unhealthy, but also their safety. And so there are some things that we can do to help navigate those conversations when it comes to working with the LGBT community. Next, we will talk about the social supports that the LGBT community and how they navigate that as well. So most LGBT persons are dependent upon their um, friends for support. That is their social network, as a number of them do not have children, and most caregiving in the U.S. is done by women, often daughters. And so nearly half of the LGBT adults do not have children, and they rely on a network of friends for help as they age, as it is discussed in the Aging and the Life course book. In this next section, I will discuss about the cultural values and beliefs or working with the LGBT community. And I will be referencing the cultural competence in the care of LGBTQ patients article. The LGBT community has a wide range of values and beliefs. And one of them is pride. That is an integral concept, cultural concept for them, is that taking pride in who they are, who they love, and also equality. So pride, love, and equality are some of the core values and beliefs that the LGBTQ community hold strong to and help them to navigate as they are identify themselves and work through the different things that are happening in society where people are not in agreement with who they are and why. And so one of the things they pride themselves on is those things. In the Aging in Life course book, it talks about factors that contribute to the difficulty in aging for the LGBT population. That includes fear of discrimination, lack of children to help them, a lack of access to benefits, pensions, and health insurance. A lot of the LGBT population face discrimination on their through their employers or co-workers, and so a lot of times they may be let go because of who they are, how they present themselves. That could be physically, what they wear, and then also just the knowledge of knowing that they identify as LGBT, as a lot of people are still in fear of or not understanding the working with LGBT and understanding that they have as many rights and just want the same to be afforded the same opportunities as others. As an organization, and some of the things that we can do to help navigate and to make sure that we are inclusive or working with others in the LGBT community is reviewing our policies, making sure that they are inclusive of their sexual orientation or their gender identity, making sure our intake forms are the same. Cultural training for staff, such as this, making sure that we are talking about this and making sure that we are keeping at the forefront, being inclusive of all individuals and their needs as well. Partner with our local LGBT organizations, and then also providing programs that promote awareness, inclusion, and acceptance. And one of the ways that we can get involved is tabling at different events such as Pride. So, Pride is celebrated in the month of June. There are parades and picnics and parties and workshops. And so, our agency can make sure that we are involved by being tabling at these events, participating with other partner agencies who provide services, making sure that those services, such as counseling and other supportive services, are a part of our HR. And so these are the ways that we can be inclusive and make sure that we are including all of those